Overview of analytes, carbohydrates. Carbohydrates can be classified in four major ways. So first, based on the size of the base carbon chain. So a triose has 3 carbons linked together, so C, C, C bonded together in a chain. Tetrose has 4, pentose has 5, hexose has 6. The second way is based on the location of the CO functional group. So we can have aldoses or ketoses. An aldose has a terminal carbonyl group, an aldehyde group. The ketose has a carbonyl group in the middle. It's linked to 2 other carbon atoms, or a ketone group. We can also classify carbohydrates based on their stereochemistry, so different spatial arrangements around each asymmetric carbon forming stereoisomers. There's 2 possible stereoisomers, the D form and the L form. And then we can classify them based on the number of sugar units in the chain. Monosaccharides have 1 unit. So mono means 1 unit. Glucose, fructose, and galactose are examples of monosaccharides. Disaccharides have 2 units. Maltose, lactose, and sucrose are examples of disaccharides. Polysaccharides have more than 10 units. Starch or glycogen are examples of polysaccharides. Cellulose is another example. Carbohydrates are reducing substances. These carbohydrates can reduce other compounds while they themselves are oxidized. During glucose metabolism, we have our primary energy source. So the nervous system, including the brain, totally depends on the glucose drawn from the surrounding extracellular fluid for energy. The first step for all 3 pathways of glucose metabolism requires glucose to be converted to glucose 6-phosphate using the high-energy molecule ATP. Conversion of amino acids by the liver and other specialized tissue, such as the kidney, to substrates that can be converted to glucose is called gluconeogenesis. A lot of times when you have big words, I like to break them down into their parts. Gluco is referring to glucose, neo is referring to new, and genesis is the creation of something. So gluconeogenesis, the creation of new glucose from amino acids that can be converted. So most ingested carbohydrates are polymers. Those are converted into disaccharides and then monosaccharides by enzymes in the digestive tract. Monosaccharides are then absorbed by the gut and transported to the liver. Glucose is the only carbohydrate directly used for energy stored as glycogen. Galactose and fructose must be converted to glucose. Once glucose enters the cell, it's shunted into one of 3 metabolic pathways, and the ultimate goal of the cell is to convert glucose to carbon dioxide and water. Again, in that process, we end up with ATP, or adenosine triphosphate, our energy molecule. The liver, pancreas, and other endocrine glands are all involved in controlling the blood glucose concentrations within a narrow range. Insulin is the primary hormone responsible for the entry of glucose into the cell and therefore reducing blood glucose levels. It's synthesized by the beta cells of the islets of Langerhans in the pancreas. It's important to note which cells in the pancreas produce glucose. 2 hormones produced by the adrenal gland affect carbohydrate metabolism as well. Epinephrine, produced by the adrenal medulla, increases plasma glucose. Glucocorticoids, primarily cortisol, are released from the adrenal cortex on stimulation by adrenocorticotropic hormone. A summary of hormonal regulation of glucose is present here. So you can see insulin from the pancreas causes decreased glucose levels because it causes the cells to uptake more glucose. Glucagon from the pancreas causes an increase in glucose. Glucagon primarily targets glycogen stores in the liver and causes glycogen to be broken down, releasing that glucose into the blood, and that increases the blood glucose levels. Epinephrine and glucocorticoids from the adrenal gland increase glucose levels. Growth hormone and adrenocorticotropic hormone, or ACTH, from the anterior pituitary increase glucose levels, and thyroxine, T4, from the thyroid gland, and somatostatin from the pancreas increase glucose levels. Two major issues with glucose metabolism include too much glucose or too little glucose. So too much, hyper, if you have too much energy, you're hyper. So hyperglycemia is an increase in blood glucose levels. Typically, when we think hyperglycemia, we think of diabetes mellitus. Diabetes mellitus is a group of metabolic diseases characterized by hyperglycemia, resulting from defects in insulin secretion, insulin action, or both. Below is a table that breaks down the types of diabetes mellitus. For this class, you do not need to know the specific details of each different type. We will go into this in further detail once we cover the pathophysiology of these different disorders. You do, however, need to know the criteria for diagnosing the cutoff levels. So you need to know how these are measured and what the cutoffs are. So normal fasting glucose is between 70 to 99 milligrams per deciliter. Impaired is 100 to 125, and a provisional diabetes diagnosis is given a fasting glucose greater than 126 mg per deciliter. Criteria for the testing and diagnosis of gestational diabetes, or GDM, is listed below. If you go back to this table, gestational diabetes down here, if you miss this, glucose intolerance during pregnancy, and it's diagnosed in the second or third trimester of pregnancy. Gestational diabetes is typically temporary, so as soon as the pregnancy ends, the diabetes tends to go away. However, the diabetes can have lasting effects in the baby, so it's important to diagnose and monitor any type of gestational diabetes. Hypoglycemia is talking about not enough glucose. So decreased plasma glucose levels can have many causes. Some are transient, some are relatively insignificant, but others can be life-threatening. So since your brain depends 100% on glucose, if you have low blood glucose levels, you can have serious detriments to cognitive function. So classification of hypoglycemia is listed below. Level 1, glucose alert value is less than 70 mg per deciliter. There will be some moderate symptoms at that point. You may feel tired, you may feel a little bit dizzy. Level 2, clinically significant hypoglycemia, less than 54 mg per deciliter. This is clinically important. It is significant and serious, and at this point you may have a lapse in cognitive function. And level 3 is severe hypoglycemia. Hypoglycemia associated with severe cognitive impairment requiring external assistance for recovery. So you have to have glucose inserted into the bloodstream and be monitored and be put on medication. And this, if not corrected immediately, can cause permanent and irreversible damage to the brain. So now the important stuff. So methods of glucose measurement. Glucose can be measured from serum plasma or whole blood. Serum or plasma must be refrigerated and separated from cells within 1 hour to prevent the loss of glucose. If you think about living cells, even if they are taken out of the body and put in a tube of blood, they are going to want to produce energy, particularly the white blood cells who are going to be most metabolically active as opposed to the red blood cells, which are just transporting oxygen. We don't want the cells that are living inside of the blood to absorb all of the glucose to continue their energy making process. So we have to evaluate this pretty quick. Fasting blood glucose should be obtained in the morning after an 8 to 10 hour fast. Most common methods of glucose analysis use enzymes, glucose oxidase, or hexokinase. Nonspecific methods are used in urinalysis section of the lab to detect reducing substances other than glucose. So this shows some of the common methods for glucose measurement. So the glucose oxidase test, you can see glucose, Oxidase is added to the blood and it produces gluconic acid and hydrogen peroxide. This does cause a colorimetric change and it is measured by a spectrophotometer. So from here, the chromogen peroxidase produces that chromogen, and you can see that using the spectrophotometer. The hexokinase method, you can see this process here, and again, ends up with a colored byproduct, and that is detected using a spectrophotometer. Clinitest uses or tests for the reducing substance, copper, and that is a rapid test for evaluating the presence of glucose. Self-monitoring of blood glucose. So people with diabetes should closely monitor their blood glucose levels to keep them as close to normal as possible. Those with type 1 should check levels 3 or 4 times per day. Glucose tolerance and 2-hour postprandial. Postprandial is talking about after a meal or after consuming something. So 2-hour postprandial test, the patient drinks a standardized glucose load, and then you wait 2 hours, and then the glucose measurement is taken 2 hours later. The oral glucose tolerance test is not recommended by the ADA anymore. Glycosylated hemoglobin, or hemoglobin A1C. Long-term blood glucose regulation can be followed by measurement of glycosylated hemoglobin. If you consistently have high blood glucose, hemoglobin is going to become glycosylated, and that can be measured. It provides the clinician with a time average picture of the patient's blood glucose concentration over the past 3 months. The glycosylated hemoglobin is the formation of a hemoglobin compound when glucose reacts with the amino group of hemoglobin. Hemoglobin A1C is most commonly detected glycosylated hemoglobin. Affinity chromatography is the preferred method of measurement. Ketones are produced by the liver through the metabolism of fatty acids. When your body uses up glucose stores and switches to fat metabolism, you produce ketones. It provides a ready energy source from stored lipids. Increase with carbohydrate deprivation or decreased carbohydrate use. So if you have diabetes, starvation, fasting, or high-fat diets. There are 3 different ketone bodies that can be evaluated: acetone, acetoacetic acid, and 3-beta-hydroxybutyric acid. The specimen requirement is fresh serum or urine. And then you can see the methods at the bottom. Those are measured using a spectrophotometer. And this is just a picture of those 3 ketone bodies. Albuminuria used to be called microalbuminuria, but it's changed since albuminuria occurs on a continuum. Increased urinary albumin is an early sign of renal nephropathy, a complication of diabetes mellitus. Annual assessment of kidney function by determination of urinary albumin excretion is recommended for diabetic patients. It's defined as persistent albuminuria in the range of 30 to 299 mg per 24 hour, or albumin to creatinine ratio of 30 to 300 micrograms per milligram. And then there's islet autoantibody and insulin testing. Islet autoantibody has to do with the production of self-antibodies against your own islet cells of the pancreas. If there are those antibodies present, it can indicate type 1 diabetes. However, this is not currently recommended for initial diabetes diagnosis.